Ulcerative colitis and Crohn's disease are cousins of each other, and ultimately at their core, they're a dysregulated immune response of our GI tract. So if you think about it, your skin is a very important immune organ. It protects you from sun rays and bugs and mountain lions and all kinds of stuff. Your GI tract is the same thing, working from inside out. So anything that you put inside your body has to be inspected and sampled by your GI tract to make sure it's safe. So there's a lot of immunity in your GI tract, and if that is not working correctly, it can go overboard and you can get these inflammatory conditions like these two. The Crohn's disease aspect is one that it can affect anywhere from your mouth to your bottom, and it can sort of show up and cause very subtle findings. It's a very odd disease. If you have identical twins that are born, one can have it and one cannot. So it's not completely genetic, it's not completely environmental, it's some combination of the two, but it certainly can run in families. And so it's a very complicated disease, and so working with gastroenterology as well as a surgeon is important. And a lot of people see surgery as a failure of treatment, and it's really not. Sometimes it's the best option. The medications we have are very good, but sometimes they can't undo what's already done. And the best way is to talk to a surgeon, remove a small piece to kind of get you back to square, and then those medications have a much better time working. Ulcerative colitis is sort of the cousin of Crohn's disease, but it's more interesting from a surgical standpoint because it only affects the colon, and it's not subtle. It usually causes like bloody diarrhea, and it's more in young folk. And people can get very, very sick from it, and medication can keep it calm, but when it doesn't, sometimes surgery isn't necessary. And the weird thing about it is that surgery is curative. Because it's a disease that's only in the colon, if we remove your colon, the disease is gone. Yeah, it changes things. We have to reroute the plumbing, and we do that in a special way. And so you're always going to go to the bathroom differently than your friends, but you can cure that disease through surgery, which is pretty cool. And both of those conditions do have a slightly increased risk of cancer. And so there are things that if any of your doctors suggest it or you have it in your family, you don't want to ignore it because those are the kind of things that can sneak up on you quickly and cause trouble. But we do have but there are good treatments, and it's always a combination of medicine with GI and surgery. We work together. Neither one's a failure. We just have to be on the same team to tell like which option is the best for each patient.